Well, my name is John Saboro. I'm a board-certified psychiatrist. I went to medical school in Toledo and did my training at the Cleveland Clinic and have practiced in Northeast Ohio for the last 20 years. I've been practicing addiction medicine for the majority of that time, and several years ago I saw a need for a clinic in the Kent area to address the needs of opiate addicted patients, and we opened up 2 years ago, October, and have grown steadily since that time. The model that I work under specifically is harm reduction, and that I recognize that although I might be personally opposed to the use of certain substances, that individuals might make a choice to use substances, and it's my goal as a physician to reduce the harm associated with that use. And then I can absolutely say unequivocally that the harm that I see associated with marijuana use is far less than the harm that I see associated with a multitude of prescription drugs. There are no good or bad drugs. All drugs are potentially useful and helpful, or they may be potentially poisonous depending upon how they're used. But there are inherent risks associated with each class of drug, and that many of the drugs most commonly prescribed to ill patients, such as opioids or benzodiazepines, have great risks, both for potential lethal overdose and withdrawal, none of which can be said about marijuana. Later on, as I began to treat patients more directly for their chemical dependency issues, I began to realize that many of them struggled with comorbid medical disorders, GI problems such as Crohn's disease, or issues that might have caused chronic anxiety or appetite problems, and many of them found great relief through controlled use of marijuana. Many of my patients have made an informed decision to use marijuana in a controlled manner for relief of their medical disorders, and that by freeing them legally to do so, I could see this only having positive consequences for both communities and families. It could allow them access. There are many patients who I think could benefit from marijuana use, perhaps as much, if not more than some agents that are currently available to them, but they won't seek out marijuana simply because of the illegality of it. And if it were available and legal and controlled, many patients who are suffering could get help that they're not able to at this time.